So we are going to start. Next slide, please. Welcome to today's webinar, Peer Support Approach for Healthcare Providers, Innovation, Engagement, and Connection to Enhance Wellness. This is our session number 4, Peer Support Skills and Competencies, Part 2. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers School of Health Professionals, Department of Psychiatric Rehabilitation and Consultation Professionals. My name is Caribel Sanabria Velez. I am the Senior Training and Consultation Specialist and also School Mental Health Lead in Puerto Rico for this center, and I will be facilitating this webinar today. Next slide. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of behavioral health and other related workforces, delivering evidence-based and empirical support practices to individuals with mental illness. Please visit the MHTTC network website for additional information at mhttcwork.org. I'm also going to provide that in our chat box. Next slide, please. If you are interested in staying up to date with our events and products in the Northeast and Caribbean, MHTTC is providing, please sign up to receive our email communication. You can sign up in the Bitly link that I will also provide in the chat in a couple of minutes. Next slide. Following the webinar, we will ask you to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The survey is also important because our continued funding is linked to the completing of our surveys. So we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted in our website along with the PowerPoint slides in the next couple of days. Next slide, please. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center, MHTTC, under a cooperative agreement with the Substance Abuse and Mental Health Services Administration, SAMHSA. All materials appearing in the presentation except had taken directly and copyrighted sources in this public domain and may be produced or copied without permission from SAMHSA or the authors. Citation of the sources is appreciated. Do not reproduce or distribute this presentation for a fee without specific writing authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. And this time of this presentation, Dr. Miriam Delphine Rittman serves as an active assistant secretary of mental health and substance use at SAMHSA. The opinions expressed herein are view of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of the DHHS or SAMHSA for these opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenter during this webinar by using the chat box. Please post any comments or questions you have in the chat, and we'll collect the questions and go for them during our presentation. You can also use the Q&A time, and we will answer all of those questions. Next slide. The MHTTC network uses affirmative, respectful, and recovery orientation language in activities. This includes language that is strength-based on helpful, language that is inclusive and accepting and diverse culture, genders, perspective, and experiences, language that is healing-centered and trauma-responsive, language that is inviting individuals to participate in their own recovery journey, language that is person-first and free of labels, language that is non-judgmental, avoidance assumptions, language that is respectful, clear, understandable, and consistent with our actions, policies, and procedures. Next slide, please. So today we are going to be our presenter, Peggy, and She has been worked for over 35 years in a variety of healthcare settings, designing and evaluating innovation peer delivery models and training programs to promote wellness and resiliency. She has created in an 8-dimensional wellness model appointed by behavioral health care agencies and state authorities across the country. In addition, she has developed a wellness coaching model and wellness self-care programs for a variety of populations, including health professionals. Peggy has published extensively on a wide range of topics, including health discapacities, wellness models, health promotions, and approaches. Now I will lead you to our presenter who is gonna be working with all of you.
Great. Well, thanks so much, Carabelle, and thank you everybody for being here for the fourth of this. It's just amazing. We started this series like over a month ago, the idea of peer support approaches for healthcare providers. And over this past month in these 4 series, we've been able to hear about the first 2 sessions. I think it's wonderful that they can record these, because if you weren't on the first 2 or even the first 3, you can go back and you'll be able to get that resource. You could hear some examples of peer support programs, the colleagues involved in reaching colleagues through listening empathy, which was the Circle program, which we presented back in November. We also presented on the one-to-one care, colleagues aligning to respond with empathy. These were 2 programs that we're actually implementing at Rutgers University that have had some great success with healthcare providers. So we gave examples of peer support. And then last week, we had the session that we focused on the competencies part 1, and today we'll move into competencies part 2. So we really have known for decades that peer support has been helpful, and it made a range of challenges. We see it a lot in the addiction field, in the mental health field, with young adults, with families. And here today, we're here to talk about the healthcare. What are some models of peer support? We gave those examples and talked a little bit about some of the competencies. So today, that's really what I'm going to focus on. Is it for you? Is it something you're doing already? Is it something you're going to continue to expand? Hopefully today we'll look at that a little bit more. So today, and you can see in the chat, you can go back and get the previous sessions. And I really encourage you if you weren't, because gives a good example of actually how you can do peer support. So today, last week, we basically went over the why of it, kind of concretized that and started to go into some of the key competencies in that training, the flow that we use in an encounter, the importance of a strength-based approach. And we ended the session by looking at the blocks to listening. So we kind of went over some of the key concepts. We had a lot of discussion. Please, as you go along, ask questions, add your feedback. A couple people followed up with feedback to me after the last time. And it's just so great to see about how people are using this or thinking about using this in their work. Today, what we'll focus in on is part 2, is just go a little more into the listening skills. All of you, you're healthcare providers or educators, you've learned listening skills, but we focus in peer support and some nuances in the competencies around the listening, particularly focusing on the strengths and particularly focusing on the self-care, which we're going to talk in a minute about why. Talk a little bit about the role of a peer supporter, not only listening to understand what people need or how to respond empathetically, how to respond in a positive way that's going to help the person, but also helping them to link to their own internal resources or the existing resources that might be available. And finally, what I want to end on today, regardless of what you do, is how can you become a workplace wellness self-care champion, how using the peer support principles, or what you can do just in general about in your own place, in your own spaces where you are. Again, the context, during COVID, prior to COVID, we know before, it's affected clinicians, it's affected the workforce. There's just been the healthcare professionals, educators have been really been impacted in a way. And there is the idea of the burnout that we talk about. There's just been such a way, and why, again, we think about a peer support or a wellness focus can really help to provide a way of helping people to go back to that whole focus on compassion and care, helping people to support one another and really affecting the issues of burnout. because that's been a really big issue. There's a lot of trouble, concern. People have been really stressed. There's been a real challenge to the workforce, particularly in what's happened in our work, and really the need for peer support models, self-care. Again, previously on this, we have focused on this a lot. One of the things that happens is there's a lot of distress people are experiencing. People are feeling depressed, anxiety. There's a lot of perhaps PTSD, trauma responses that are occurring for people. But again, sometimes it's just not as much as we think. It's there, we need to address. There's the risk of health risk behaviors when we're under chronic enduring stress. But again, want to keep highlighting, I'm always big with the visuals, with the wheels. The resilience, again, over time is stronger. And that's really where peer support focuses. And that's why we focus on the strengths. We focus on people's coping. We try to listen with our eyes, our ears, and our hearts to understand and help people to activate their true resilience that occurs in everyone regardless. So it's been in the United States and around the world, there's a lot of research showing the healthcare workforce, the education workforce has been impacted by the effects of the stress and the strain. And it's had an effect on the individual, families, communities, and why do we want to think about what are the kind of interventions, what are the kind of work environments we can create? Why peer support? Why a wellness focus? Why a wellness champion? As I mentioned previously, again, we gave the 2 examples, and I wanted to give you a very, very, very updated scoping review if you want to refer to this, that shows a lot of these self-care interventions that are being used and things you may be doing or thinking of using. Things like the mindfulness training, you're seeing a lot of that, cognitive behavioral therapy strategies being adapted and doing physical activity. There's also the systems level focus we need to think about, making the working conditions favorable in terms of workflow and process. And that's really where we can see all these things. We're developing the peer support skills of your workforce, whether it's a formal program or an informal program, can be so effective. Again, the resilience piece, we want to focus. We can use these other strategies in the work environment, but we want to really be thinking about what can we do? Again, all of these work, but a workshop does so much. Communication skills, again, that's a core piece of what I'm looking at in the peer support model. How can we create that workforce to really build that resilience and affect that burnout in healthcare and education? I definitely would encourage you to look at those resources that really complement a lot of what I'm talking about. But again, peer support, is it ready for you? It's based on a role, peer support, again, from a definitional perspective, that role experience, but also those vulnerabilities we have in those experiences. So when we think about doing peer support, whether it's formal or informal, we always have to come into our mindful eye that we have similar vulnerabilities and we're there to lend a listening ear, a listening heart, a listening mind, to hear what's going on with someone else so we can provide that support. But we're meeting as colleagues. We're not there to say, Peggy knows that story, so I can tell you my story and you do it my way. It's not peer support. Some people do that and think that's what it is. I got to tell you what I did, and that's the solution. You need to handle this anxiety or stress you're dealing. Peer support is listening, recognizing your vulnerability, maybe your experience, but providing that experience, listening with the eyes, ears, and heart to understand it from that person's perspective. So you're in that role because you have, by virtue of the role or experience, a shared experience. But again, there's these skills we have to think about: the listening, the focusing on the strengths. And again, we talked last time about the personalizing peer support. It's got to be, there's differences about this individual, whether we might have the same job, we might have the same vulnerabilities, we might have the same experiences, but there's all these host of differences that we have to remember. So it's about finding that connection and building that resilience by listening, connecting through those similar experiences and similar situations, but then really healing in a way, helping to foster the healing through this reciprocal support we can provide to people. So it's really truly thinking about those listening skills to help provide effective peer support. And we talked about it last time. There's the emotional support, the informational support, and the practical support that can be provided to another person. And how do I do the emotional support? How can I give information? How can I do some practical aspects of really being able to help this person who's come to me and is talking about this distress that they might be in, or nearing that distress, or maybe even moving into a crisis? Is that I have to really start to use my core skills of listening. Really thinking about the listening to engage, listening to reflect, listening to respond, and explore what's going on with the person, and really opening up my ears, making sure again, we use in one of the checklists is tolerating the silence, watching our blocks to really listen to that person's experience and start to listen for the strengths. Even though it might be a difficult situation, we might listen for the strengths. And when we do our reflection, give that reflection back to the person and start to listen for supporting the person's wellness, supporting the person's self-care. When we think about the act of listening, we think about that listening, it's really that ability to take in the content and the feeling of another, and really just being able to be fully present and to be fully aware of what they're saying, how they're feeling, what's going on with them. And really, like I said, one of the biggest things you want to think about is listening more than we speak. That's an important piece. Listen for that content, feeling, and meaning, and really be focused on that. So it's listening. Again, when we reflect, the reflection responds with an understanding that we truly heard the person, not adding anything else about our story or about other things, and an interrogation of questions, and respond. And then using what we talk about as good open-ended questions. And I'm going to just give some examples of those as we go along. I highlighted last time in the session, it's that listening with our ears, with our eyes, and with our heart. Those are three pieces that is so important. And when we want to think about how do we listen with our ears, it's really then taking our mouth and trying, putting that thing over our mouth, because sometimes what happens is, and I see this a lot, even with trained peer supporters, people start to want to tell the person what to do and jump in with the solution. Very, very hard. But I remember, think about the senses for yourself when you're really either doing peer support with someone or listening to someone. Try to think about the ears, the eyes, and the heart. And it can help you to cue you to start to listen and keen in on the content, the feeling, and hopefully even the meaning of what they're saying. So really, really key is the listening skills. I want to see if there's any questions I've been so far before I move a little bit along, but are there any questions in the chat so far, or anybody want to add a question so far of what I've talked about? I've given us a background around the why, and then started to focus in on this first skill today after we've defined peer support of being the core listening skills. Any questions or comments from anybody who's participating today?
Hey, until this moment, there's no comment in the chat box. I will keep you posted.
Okay, and I would like to ask the question, what gets in the way of us listening? If anybody wants to post that in the chat, what gets in the way of listening with your eyes, listening with our ears, and listening with our hearts? What would be something that would get in your way, or you think might get in the way of someone who's doing peer support? If anybody wants to post into the chat, what do you think gets in the way?
Somebody mentioned waiting to respond.
So, yeah, waiting to respond, because it's that urgency. So it's that waiting period can be hard to do it. Yeah, wait. Thank you, Josh. That's really good. Yeah, it definitely gets in the way there of us being able to use that. What other people, anybody else want to share with yeah, distractions, the distractions. So that's one of the things that we talked about last week, is that being mindful of the distractions that might, and it's trying to come to this encounter fully aware. And you could be distractions going around you, but focusing. Our own stress, Jacqueline also said, yeah, our own stress, being mindful of our own stress. We also said preconceived assumptions. That is a real one that we want to really think about when we talked about the listening blocks last time. That's definitely one to keep suspending our judgments, our biases, and our assumptions. And again, Josh highlighted that too, that judgmental piece or comparing. And it's really tricky because you compare, you're there as a peer, you have these shared things. So we start to do a little bit of the comparison, but it's when our mental, when our head starts to move to that comparison too much. Oh yeah, Karen, fantastic. The thing that we see it even in a lot of the training that I've been doing over and over and over again is we want the solution. We're, especially if you're a healthcare provider, your educator, you want people to have the right answer or the solution. And you want to provide that solution. The idea, rather than focusing on really, again, going back to that piece, which I highlighted before, of listening and engaging and reflecting, responding, exploring, we jump too quickly to that, so those are really very, very important pieces to keep thinking about when you're in a peer support encounter. Great. If anyone else wants to share any, we'd love to hear that. But yeah, think about what gets in the way. Our own stress, our own work environment, our own family environment, our own challenges, as well as these preconceived ideas that come about. So definitely thinking about if you can, and I really encourage you, whether you're doing peer support formally or informally, I really feel we need to refocus our whole workforce on some of these core principles of using peer support for all workforce encounters. Because if we start to use these more, it's going to go back to what I talked about in the beginning of this need for the workforce to change these workforce flows and create these workforce environments that we actually are providing, using a lot of the peer support skills to just help us be better colleagues together. So, if anything, you don't have a formal program, think about just the informal. And when we think about the exploring piece, this is the one that really also gets people. Whenever I observe it, or even myself, I have to kind of think about how do I explore, and using open-ended questions. You go to trainings on this all the time, but that's one that really needs refreshment and refinement. Because the benefit of an open-ended question, and I have a colleague, Dr. Spagnola, she'll talk about like people disguise these open-ended questions with a real direct closed-end question. And you see people do these imposter kind of questions. Open-ended questions open up that exploration step that I was talked about recently. And they really help people to pause and think and reflect. So when you use really, really good open-ended questions and then don't start to jump in, you can really give the person the time to start to really kind of think this through at a deeper level, which probably is why they're stressed, because they haven't been able to, and they might not have been in a place to be able to think about it. So because there is a lot of distress, but open-ended questions really help a person to really think about this at a deeper level. And, what's going to happen for the person is going to allow them to share and express something that might be bottled up or something that's out of their awareness that's really getting in the way of, their own mental health or physical health or social health. It's really going to be affecting a lot of the dimensions of wellness, but it really helps to unlock that for them. And it helps them to start to get better at expressing or even in tune with, maybe not even expressing, but in tune with a feeling. Maybe it even brings out an opinion or idea that they didn't even think about. And it also really can just also really help the person to kind of come to this greater awareness. And then sometimes it helps with the ventilation of the idea or the feeling. Often many people find is helpful, but it also helps people to start to do some of the problem solving themselves. Because yeah, you want to get to that, we talk about the advice or the problem solving. Eventually it moves that for the person, but the best way to do it is that the person problem solves it for themselves. We might guide them through it again down the road if the peer support encounter continues, but that's just really where it helps a lot. So it just gives you, because sometimes people say, how do I do open-ended questions? And I'm always looking for like, okay, here's ideas, but here's some just words to say why, and don't go into a long sentence. How, what, can you describe? Tell me about. What do you think about? Like, these are good, what we call like stems to begin with, but don't go into answering the question and start to put it in an imposter question. It's just throwing out questions that are very open-ended, with sometimes these stems really help to get it started. And I think, these are things that we do encourage you to practice with your colleagues, practice with, there's further education around this. You probably have training, but they really do work well. And the more you can use these pretty regularly, they will come very automatically. But don't want to be practicing the question without listening to the person. So that's the other challenge. But definitely remind yourself about open-ended questions. I'm sure all of you have had that training before, but definitely revisit this from time to time. And if you have supervision, it's a good thing to work in supervision on. Some other formats, because part of what we've gotten feedback is people wanted practical ideas about some of this. Here's some other formats or ways you can think about how a good open-ended question could be able to be used. Again, you're always contextually bringing in what the person is talking about with these. That's why we're just giving these general ideas around some of the wording, but you have to kind of fill in the blank with the context of what you've heard from the individual and what the real story is that you're listening. So what are the things you like or dislike about, this topic you're talking about? Can you give me a typical day of a typical example of a day, or a typical example of this situation? Walk me through what usually happens in that situation. It can be hard, and then reflecting on what they're talking in, what makes it hard for you. So just trying to really think about that. So again, thinking about the open-ended questions. And again, what I highlight in that is that the one thing that becomes challenging, I think, in peer support encounters is the feelings and the expressions of feelings. And that's also something in the listening skill component that we find is very challenging when people are learning to do peer support or learning to do this work, is hearing difficult feelings being expressed. A lot of the different, when you think about it, with this picture here shows a lot of that stuff in the misery. It's hard to hear misery. It's hard to hear pain. It's hard to hear heartbreak and sadness that the person may be, sharing with you. So, but you want to try to really think about your peer support encounter, being able to listen to that openly, being receptive, being curious about it, and not trying to jump to solve this problem for the person. Allow for that expression of the feeling, but then starting to help the person to understand this situation for themselves, and maybe even be able to sit with the situation more, and then again, moving to the next piece of the training is focusing on that resilience, focusing on that self-care, focusing on that wellness for themselves. So really thinking about that. I want to know if anybody thinks, like, what is the most difficult, thinking of your own community, your own support that you provide others, or peer support you provide others. What is most difficult about, in terms of like thinking about doing peer support, hearing some expression of emotion? What also gets in the way of a peer supporter really hearing and being open to listening without responding to the intense emotion? Does anyone want to add any further ideas about that in the chat? What are some other things that might get in the way for someone doing peer support, that might get in the way of being able to really be able to hear and sit with that intense emotion? So the personal connection, the personal connection perhaps to that. I think, Jennifer, maybe if you want to expand a little bit more, maybe personal connection to the feeling, is that what you're thinking? Yeah, the lack of the training to sharpen the skills, that's definitely where we think that, you just coming to this training now is going to start you off, but then you're going to want to go into further training and then getting a highlight at the end, the supervision, the support. Jennifer's talking about the personal connection to the situation or feeling. Yeah, that's a big one for a lot of people. And again, it goes back to like, you are sharing the vulnerability, you're sharing the experience. So again, you have that personal connection, but in your role, how do you try to help to, sometimes you can, validate or acknowledge it in a certain way, that connection, but how do we keep our own emotion in check? Perhaps I always think about the open wounds that we may have, or the things that are still healing for ourselves can be the thing. Again, we talked about at the beginning, part of this is about the transformation and the healing. We probably are also maybe healing in a similar way, and it can hit that chord for us, or it can hit that. Yeah, definitely be aware of this. I love this thing because the training is important. The supervision or support or a peer support you can provide for each other is really going to help you to refine and build these skills over time, keep sharpening them over time. And again, yeah, the resources to support the process, definitely. The resources that and help the person to link to those resources, the resources that you might need to continue to do this and build yourself. Those are all things that can be really important. Again, if you're doing peer support or you're thinking about peer support programs, can be important to think about. So another piece in terms of the listening, before we move into the self-care, that's another piece of this listening skills and what happens in this peer support encounter that we find out that what happens in the flow is often through this dialogue. You're listening and you're responding. There's ways to help people to not tell them, but help them when you truly listen, respond, reflect, move forward. There's ways to help people to start to reframe the situation for themselves. And that really is often a really positive outcome of many peer support encounters or multiple encounters, is helping the person to reframe the situation. It's not resolving the situation, put the Band-Aid on or whatever, but help the person to see the situation as accurately as possible. So through a good peer support encounter, there's going to be this reframing that perhaps the person may be able to see, and through your dialogue with some really good open-ended questions and some listening and reflections and responses, and that connection, and perhaps sharing your narrative, which would be a whole nother training we could talk about. You can also help the person see the positives and negatives with the situation, because what you're going to find a lot, and again, we do this ourselves a lot. This is what happens, why we're in this, moving into a crisis mode, why we're in distress, is sometimes there's these distortions. There's the real situations happening around us. There's all the reality of COVID. There's all the reality of what's happening. But often what's really getting us in trouble and leading us into the distress and often the need for a peer support encounter is the distortions that we bring to the events or feelings or situations. And it happens a lot when we're under stress or intense stress. So reframing is often another piece that will occur through the dialogue and the peer support encounter to help the person to gain some perspective of the situation. It's, again, in your dialogue and encounter, if you're focusing on these other skills that I've talked about, is your start to really help to validate for the person that they are the expert. And that's through your, listening and validating the strengths in what you're hearing with them, and acknowledging and exploring past experiences of skills or resources that they've had in similar situations, helping them to think about those things through some good open-ended questions, and start to help them to understand that they do have these skills, they do have these abilities, they do have these capacities, that resilience piece that you're listening and responding to and shining the light on. And it helps them to sometimes gain some perspective of the situation. You have to be genuine with this in your use of it and buying it, but it really, really helps people a lot in using reframing statements. And sometimes one of the things we do, we've heard people use in the way they respond is like that, they've told you the situation, they're beating themselves up, they're beating themselves up. And, asking them questions and saying, if you knew someone in a similar situation, a friend that had that similar situation, what would you say to them? Would you say those same things about themselves or the situation as you are saying to yourself, like getting them to think about that? And often what we find is, and you've had to have trust with the person, you've had to have some dialogue with them by this time, they often say, oh, no, I would never say that to them. This is just me. I'm this, and then they start to talk these negative things. But, then asking them, like, what would you say to them of a friend in a similar situation? And when they can reflect on that or respond to that or share or discuss what their response to that person is in that similar situation, it's one of the strategies to helping with the gaining perspective. So it's just thinking about how you can listen to the story, and again, a way of using a reflection and a way of help a person to think about the reframing that they do. And that it happens often quite automatically in a situation, in an encounter. One of the things that happens with these, when we think about the reasons for the need for reframing, and this is where you're going to be able to hear or see with the person needing, perhaps learning how to reframe the situation, is something many of you have learned in other kinds of sort of CBT type of training, perhaps, that there's these automatic thoughts that get in the way. And this is really what happens a lot of times, is you're able to, through the dialogue, help the person understand those automatic thoughts, those things that are distortions that are often getting in people's way. People are often ignoring the positives, and that's the biggest thing, their mental filter. I think that's the greatest strength of a peer support encounter. You can help shift that mental filter towards the wellness, towards the positive, towards reminding them of their strengths and their resilience. I think that's the biggest piece that peer support really can help with. Peer support also really can help people with that excessive responsibility. So people have got to carry the burden and shoulder it on themselves. And again, start to think beyond that there are people who can help. There are families, there's supporters, there's workplaces that can change. There's sometimes people get into the mode of the all good and all bad, that all or nothing kind of thinking. And that definitely happens when you're under a lot of stress. And also, again, the negative outcome, the negative projections that people often have. So I just wanted to highlight this. This perhaps is familiar to some of you that might be in some of your training if you're clinically trained, but again, it really works well in peer support encounters to help people to unlock and to really rework through some of this automatic thinking. I gave some other examples into the pieces, but I want to move along from a time perspective. Please send questions, if there's things that I'm talking about too quickly or you need more information. But I want to move through the listening skills to this other piece, the linkages as a big resource, a big skill in peer support, linkages to wellness, linkages to self-care resources. So people are stressed and people are really often, talking about things, and they're, how do you help the person to think about the things, again, maybe not just relax, but help the person to get out of that stress mode and help people to sort of move towards the balance that they want and feeling better. Trying to think about, again, in the encounter as you're talking to people, what are their coping strategies? Asking that, using those some of the open-ended questions that you could bring into this point to really focus in on what are some of the skills that they have. I think of it as external resources and external resources, those internal resources that person has. Then what are the external resources that might be available to people, things on the internet, things that you know about, and or in your work environment, you may know there are formal things within the workplace that are available to people, knowing those and encouraging people to access them. And again, many times people are, and again, thankfully now there's a lot less stigma. People are accessing, say they're in a work job, they have health insurance to get therapies or get kind of formal services. not saying you should go to this therapy, but sometimes that does come about, like talking to the person about the availability of that resource being available to people. And remember, again, moving back, when you are thinking about what's the resource that you're going to encourage them to seek out or maybe walk together through to help them access as a peer supporter, making sure you're just not imposing your ideas or solutions or knowing, based on, okay, that's available, I'm going to tell that person and tell everybody about it. Understanding that personalizing peer support, understanding what might be a better resource for this individual person. So I love, of course, everyone knows me, the wellness wheel, right? Thinking about strengths in our physical domain and the sub-dimensions. There's a lot of physical dimensions that people have a lot of strengths on, a lot of challenges, the strength, emotional, social, intellectual, environmental, financial, spiritual. Trying to think about the person holistically, again, using your eyes to see the lens of this individual. They have social needs, emotional needs, intellectual, and they have strengths in each of these areas. So talking about them, about their self-care in all of the areas, because the challenge may be most in emotional, and that's the most imbalanced. But sometimes when you can bolster the social, or you can do something in the physical dimension, it has that effect. You see how the dimensions affect each other. So really helping people to think about the resources of their own internal resources, the coping skills, and then maybe other resources, and thinking more holistically about the resources, not just emotional, because if everybody just thinks, you're just putting people to therapy and all that. It's not, there's all these other areas that can really help strengthen and build the resilience of the person. I gave you resources you can go to here, some materials that I'm available. And if you need more information about wellness resources, definitely reach out to me and I can direct you to some more. So we've talked today again about peer support skills of listening, the pieces of linking to resources and focusing on the self-care, focusing on the strengths. Finally, today, as we end this series, whether you're thinking about these core competencies that we've highlighted in the last 2 sessions in these examples, one of the things, when you are a peer supporter, whether it's formal or informal, you can become a champion of this. And I think a champion is that person who kind of really takes the lead with this and takes some ownership of it and tries to help build, like, again, it takes the peer support principle, build this culture. And we need this more than ever. I've been talking about this stuff for years, honestly. And right now, within the last 2 years, it's this critical point. So thank you for being here today, to even be here to listen to this. Or if you've been on part of these series, you can be going back, and you probably are in your workplaces, be that champion in your space of your team, in your program, in your agency, wherever the space is. Think about being a champion, starting to use some of these peer support skills just in your interactions. And then if you are a formal peer supporter, using them more, building your skills. And if you want to develop a program, just really start to work on this, because we definitely need a movement of this, and we need to have it can help a lot. It's not the answer to these problems, but we have so many issues with our staff not feeling good about the work, people feeling overwhelmed, and then people getting sick unnecessarily and leaving, really great people leaving this important work that we do. So becoming it. And remember, peer support happens, you're going to do peer support. You're going to create this culture of wellness. These short connections are so important, and they can be so powerful. You don't really know, just a short encounter using some of these skills with a fellow colleague in your workplace, in your workspace, can have an effect on that person's life, to help them, activate them to perhaps, change their perspective, remember their strengths, build their resilience, help them to get through a situation, or help them to access something that might be able to help them get through a storm. These short connections can be powerful and important. And I really think that we can think about the places and spaces, whether it's in our huddles, in our team meetings, in our activities we do. We don't have to do something extra, it would be great if there could be some resources available to help extra in creating these spaces and places within our workspaces, but try to just think about existing things you're doing already and start to plant the seeds, incorporate some of these skills, shift our focus on the peer support skills, using them, but also the focus on the resilience and the wellness. Creating that culture of us being able to take care of ourselves and care of others that do this work. It takes competition sometime in the work. We get angry, frustrated about policies and procedures, but then it's just remembering ourselves and our colleagues and just taking those short connections, powerful, and finding those places in space. And so I want to just hear today, yeah, leadership is definitely important to this, but let's not necessarily wait for the leadership. Let's role model it to the leadership, right? Like that's been my way. Back in the 80s, I started doing this work in some pretty difficult places and spaces. And the leader, once they started to see it, they responded. And that's like people say, how did you start all this? It's like I started it really small and started focusing on it in small places and started to just role model it and get more like-minded people to be around. But definitely think about that. It is leadership, and but you guys can re-role model it. So think about for yourself. I'd love to hear today, what did you do for your self-care? What is something you did for your self-care? I'd love to hear this. Again, we want to remembering, practicing, focus on our wellness, practicing, focus on our care. What have you done? Love to hear today, or maybe even yesterday, what have you done for your own self-care? It's nice to see and hear that. So love to see in the chat, mindfulness meditation. Excellent. It really helps a lot. People learning this more, people have done it for decades, feel comfortable now sharing about it. Before people say, what is that stuff? But now we see it's so powerful, so important. What are others have done? You can think about your spiritual, took time to reflect and slow down, not always in a rush, prayer. We see as people doing in a day, taking that time to reflect and pray. Great. Others that are on the chat, I'd love to hear what you're doing for what your own self-care. Brought a sports car. Oh, that sounds really cool. Yeah, fantastic. Did something for your own self-care. It's going to help you in so many different ways, and the nice little bow for Christmas or the holidays, I'm sure will be nice car. What other, what are you doing for ourselves? And again, as peer supporters doing peer support work, it's a question we would ask of ourselves or think of ourselves to be able to keep our cup full to do this work, to be a champion in the workplace. If we're going to think of just being a champion, if we're going to do peer support, it's thinking about doing this for yourself. Having breaks through my final exam. Yeah, having the breaks, taking those breaks. Somebody going to go to choir practice tonight. Yes, singing and doing those hobbies, those things that we love, those things that bring us passion, keeping that balance in our life and doing those and planning and doing those activities. Excellent. Thinking about that. Thank you for all sharing these if anybody else wants to share. But again, it's a question when you do peer support, when you're thinking about, it's a question to just keep bringing up to one another and reinforcing it with each other. Because we want to take care of ourselves to prevent the rain getting too soaked and saturated with our things. It's a key piece for our work. I do want to just highlight another thing. We highlighted again about being a champion, whether you want to do this formally or informally. It's just encouraging to checking in and asking others what they're doing for their self-care, or just checking in and with each other's and encouraging each other. Scheduling the time off, taking that breaks was said, encouraging it and helping people to schedule it, doing it for ourselves. And really important for the peer support work or the champion work is seeking that supervision, seeking consultation as we need it to help build our skills and keep again, going back to our previous thing, keeping our own cup full, that we can really continue to practice this work. So this is just really important. I did add a couple of things in the end. I'm not going to go into it, but I definitely gave you a couple of resources around some things that people could do, some guided reflections. You could bring them into team meetings. It's just some materials that you could add into a, into a team meeting or into a resource if you want to start to just practice it within a team meeting or huddle. It only takes a couple of minutes. I've given you a number of resources. Here's the resources from me if you need to, want to come and, follow up with me. But I would love to see if there's any other questions that I can answer for today as we end this series of 4 sessions on the different types of peer support approaches. Please let me know a question you have about anything, or if you feel in the chat, we'd like to hear, is there anything either today or if you've been part of the series that you feel like you could do with this information? We'd love to know if you feel there's something that's really going to help you take this information and start to put it into your work or continue to expand your work. And maybe we even have time if we can are we able to open if there's open question? No, maybe.
There's no questions right now in the chat box on the Q&A. I write your email over there so people can have it.
Okay.
And can email you if they need anything else or if comes something to their minds or something like that.
Yeah. What in terms of today's presentation, what do you take, if you could even just poked in the chat, one thing you take away from today, like love to hear what you're taking away, or unanswered questions, post in the chat. What's your one takeaway, or what's your one unanswered question, so I can make sure I make this an experience that's most useful for you today.
We added the same question that you asked
Okay.
right now in the chat box,
Yeah,
just in case somebody needed.
Questions or your takeaway. What do you take away from today? What do you, self-care is the basis for peer support process. Yeah, if you can't, and you might still be working on yourself a little bit, but it's keeping in tune with it. It's awareness. Wellness is a conscious, deliberate process of being aware of and then making that choice. I love focusing on listening blocks and how to refocus on the individual. Yeah, that's the one thing, Josh. Again, we can continue, we learn the skills, we master them, through our curriculum and our training, but it's one that you want to, 30 something years in, I'm going to continue to refine and improve this skill over the rest of my career, continue to develop it through feedback, through continually learning about using it. And it's so, so essential for the peer support. Yeah, others, anything, take care of me at first and then be able to help others. Yeah. And then keep getting that support for ourselves. Again, that's why keeping this champion model of like using, you may or may not be able to do a formal peer support program, but maybe starting to train one another. And the good news is you already, mostly if you're working in healthcare, have had this kind of training for other things. It's just trying to say, okay, now we're going to role model it with each other. Like, makes sense, right? But we don't always think about it that way. And that might be a way to help colleagues to just not think it's another thing they need to do. It's a 360 process. Yeah, one size does not fit all. Yeah, and again, you have to, each individual, and for each way you might think about implementing this in your workplace, it's going to be very individualized. But I think if you go back to the core principles of these models, you can go back to the original 2 examples we gave of the 2 programs that we've done with physicians. It's been very powerful, and we're doing it with residents now. There's other peer support programs that occur again for the workforce. It's so, so needed. So want to, anything else, you're thinking today that you would like, follow further up, please reach out to me. But I really encourage everybody to get leadership buy-on. Yeah, how to get leadership buy-in is like, I guess there's a couple of ways to do this, is to sort of like think about what you want to do and what you're able to do. And then it's just start to approaching, the different levels of supervision you have. It might be, your immediate team or your immediate department where you have to start. And then depending on what kind of resources it needs, you might have to ask other administrators. But depending on the type of program you want, it's going to be different. And I could definitely follow up again with anybody who wants some specific help on that. But I always try to think about starting small with something, and then, working with your immediate supervisor or your immediate people that or sort of would naturally, they would be okay with this thing you want to do, and start to work there. I do think one other thing that really helps when that's why I gave you references and resources showing like evidence out there. The National Academies has some really good reports recently that you could show that data from these high level, research and high level institutions that are saying this is important. That sometimes brings awareness and buy-in from leadership. And/or, there's a number of grants that are available currently that are starting to be able to support initiatives on this topic. So that also helps a lot when you can show that there might be funding for a program if you want to do something more formal in terms of a program. But yeah, definitely you can be approaching leadership at the various levels of leadership. But again, sometimes when you really have you can concretize what it is the ask is, and then demonstrate to the leadership, whatever level, and then have some sort of evidence behind it, or some that, in maybe a one-page summary that highlights maybe some citations of some other models that are doing this. That often can help leaders to say, oh yeah, they're doing that over here. This is actually a national trend. Things like that do get their attention. And I don't think that, my sense is like sometimes leadership doesn't not want to do it in a sense, but it's sort of like, where is it on a priority of the 100 other things in the leadership's lap, but I think when I like to think about wellness, when we move from the I to we, illness becomes wellness. It's a we thing. When you can also help the leadership understand how it's going to help them, that also might even help them to see, yeah, we even need this in our leadership team, and it might be a good thing for our leadership to create a good work environment. Yeah, so how do we others take a wellness day opposed to a sick day when we feel like we're running up the yes? Yeah, I think that's definitely something that takes self-awareness for people. And that's really where peer support comes in, or your colleague support is giving each other honest feedback with each other and encouraging people to think about not waiting till we get sick to take that time, so you're not running on empty. And perhaps, just in peer support is just giving certain feedback to one another, or as someone doing this work is doing self-reflection from time to time, is something you could be thinking about. Who is my peer supporter? Like, we all have a peer supporter, I'm sure. I've talked to people, they have peers. I have certain peer supporters of people in my work. They're not like using those peer supporters to talk about that, or helping them to maybe give us that feedback, is a way to think about it. And if you are a supervisor in a supervisory role, sort of developing that relationship with your employee to kind of help them to using sort of the skills to help them to identify that this might be important for them, and making that I think the language there is like more awareness, like we want to be focusing on the workforce mental health. I think there is a lot less of a stigma of that these days, but it's a great, I think that's say it's a wellness day. Maybe it's just changing that language, and that even in that of itself might help the person to think about that. Okay, wellness day, I'm going to go do that choir thing, and like someone, Karen said she's going to do, or I'm going to go do that fun activity that I don't do on a normal basis, and I know it's good for my wellness. But today, I really was there trying to summarize this series, thanking everybody for participating in any or all of the sessions. That today focusing on, the peer support competencies part 2. I spent that little bit of time at the beginning reminding us of the previous sessions, but focusing mostly today on the core skills for listening, for strengths, and some techniques and strategies for focusing on that. The idea of the self-care and the wellness focus, and just ideas that whether you're doing peer support or not, how do you become that self-care or wellness champion in your workplace? Hopefully today you've got some ideas about that, or it's going to strengthen what you're already doing. And we would please send me any questions further, or anything that this could have been more helpful that I might not have answered. I'd be happy to follow up with everybody. Want to thank everybody for participating, and just keep up this important work. We need this, our workforce, so much now, more than ever. And so this idea of peer support or wellness and self-care is just so important. So your time today is really appreciative that you are even thinking about this, because you're probably role modeling this for your other fellow colleagues. And want to thank you for that, and thank you for the work that you do, and thank you for your time today.
Thank you very much, everybody, for being part of us today in this webinar. I want to thank also our presenter for giving our time and that a lot of knowledge that we have. I put it in the chat box, our emails, and also our webpage that it's going to be, this recording will be there with the slides presentation also. I also have included the email of our presenter. So if you need something else, we will be gladly to receive any email and answer any questions. So we conclude this for today, this webinar presentation. Thank you very much for everybody participating and being here today.